Hi guys! Hello everybody! Welcome to my little office. Anyway guys, this is my little office here. This is where I do my assessments and everything. So this is my little nook. Anyway, so guys, meron nagtanong sa akin sa mga comments na ano ba daw yung mas mahirap magtrabaho sa as an EN, in the aged care ba or in the hospital? So this is only a disclaimer guys. This is only based on my experience. So so I also base in my experience from the previous placements that I have in aged care and in the ward. So I'll tell you guys, since I'm working in an aged care as well, and then sometimes I do casual shifts in the hospital, so I might just do as well a video about the comparison of EN's job description in the aged care facility compared to the hospital. Actually, I have a note. I have a note talaga. Anyway, guys. So, yung aged care, guys, meron siyang dalawang types dito. Yung private or yung public. So, yung public is attached siya sa public hospital na aged care. Meron ding aged care na separate, na private lang talaga siya. So, hindi siya connected sa hospital or sa, like, hindi siya public. So, it's a non-profit organization usually, yung mga private. So, as an EN, well, let's start in the ward as an EN, see? So, the patient ratio in the ward, like the one that is connected to the hospital, or yeah, we'll just talk about patient ratio. So, as an EN in the ward, you will have at least a minimum of 4. Well, depends on how big the hospital you're working with. You have at least a minimum of 4 and a maximum of 6 patients per nurse. So it's actually team nursing usually. So you have 10 patients and there's 2 nurses, and you will just share. It depends on either you are in a rehab or in a medical ward. So usually in a medical ward you have 4 patients in 1 nurse. In a rehab we have 5 in 1 nurse. And so that's in the hospital setting. So you have the patient ratio is usually 1:4 or 1:5. Sa aged care naman, different siya kasi merong mga PCAs or mga personal care workers sa aged care, especially sa private. But in the public, I did a placement once and I really can't remember how many patients. I think it's still the same, the patient ratio in a public aged care. I think it's 1:4 or 1:5. But anyway, that's the public hospital. And in the private aged care, well, as I said, it depends because they have PCAs or personal carers. So, usually, maybe there's 12 residents and there's an EN which is a team leader, and you have 2 PCAs for, let's just say, 19 to 20 residents maximum. 20 residents maximum for 3 staff. 1 EN as a team leader, which the role of an EN is to give medications. So, give medications, help with the care, help with the personal carers with the care, hygiene, manual handling, repositioning, toileting. So you have to help with the PCAs, but that's an additional job for you. Wherein in the hospital, mostly as an EN in the hospital, mostly the patients are mostly independent. Maybe 1 in 4 patients is not independent, so you have to help her with his hygiene and ADLs. But in aged care, we'll just say half of the 20 residents needs assistance, so you have to help them with shower, toileting, repositioning, manual handling. So most of them really needs assistance with ADL. So there's 3 staff, you doing the meds from a Webster pack, and then the carers are there to help you. So you have to do meds, hygiene, ADLs. Sometimes you do the wounds. And the manual handling in aged care is heavier than in the hospital. So let's talk about the pay, guys. So in a private aged care, I would say the pay is lesser compared when you are working in a public hospital. So there's a big difference with the salary or the wage. Let's just say how much you get paid per hour in an aged care, private aged care compared to public aged care if you are working as an EN, or private aged care compared to an EN in the hospital ward. So you get bigger pay in a public hospital compared to a private aged care. So that's the pay difference. Well, it also depends on how many years you've been nursing. So that will vary how much you get paid. Medication wise, right? So wherever you are in the hospital, you will have either, depends on the hospital you're working, depends how high-tech the hospital you're working. Sometimes they have, you know, those computerized medication, I don't know what it's called, but you just press some buttons and then the medications will come out, and then they will have a big impress of medications. It's a separate room where you have all the medications there to put in a bedside drawer of the patient, and then you will give it one by one from the cupboard. So you will have to really look at the box and the date, expiry dates and everything on each medication. So that's in the bedside usually. Sometimes it's in the, like what I said before, the computerized medication cupboard, and then that's in the hospital ward. While in aged care, most of the aged care, but I don't know in other hospital aged care that are connected to the hospital, but in a private aged care, based only on my experience, guys, but I don't know about the other aged care facilities, but this is only based on my experience from my previous placements. The aged care, private aged cares, they use Webster packs to administer medications. So you have, let's just say you have 19 to 20 residents. You will have 20 Webster packs that comes with their name, date of birth, and all those details about their medication, the medication doses and everything. It's all in a Webster pack. So it contains all the tablets that they have. Usually a Webster pack comes in like, it's like a plastic, it's like a plastic thingy with some plastic things there where the medications are their time, morning, lunch and dinner. So they already put it in a specific it's like a container, but like it's a Webster pack. I put a image here somewhere. So that's how Webster pack looks like. So you have the morning, the lunch and the dinner time tablets, and maybe in one section there's 5 medications there, and then the description of that medication is behind the Webster pack. So you really have to double check with your drug chart and the Webster pack if what's in the drug order coincides with the what's in the Webster pack. So it should match the dosage, the timing in the Webster pack. So you will give the medications in an aged care, private aged care, through a Webster pack. So that's the difference with medication administration in an aged care versus in the ward. Now let's talk about manual handling. So I would say, again, based on my experience, I would say manual handling is more heavier in an aged care facility compared to the ward. So in the ward, if you are an EN, you will get 1:6 patient ratio. And so far, maybe 2 or 3 patients out of 6 needs assistance with ADLs. So yeah, everything. Well, maybe we'll just say 1 or 2 of them needs full assist, and maybe 2 of them needs minimal assist. So anyway, if you have 3 staff, 2 staff assist, the others will help you anyway. But mostly, maybe half is independent, half is needs assistance. So that is the manual handling wise in the ward. In an aged care, 3/4 of them needs assistance, and 1/4 of that 20 is independent. So when I say assistance, you have to help them with toileting, you have to pull the pants up, you have to help them with hygiene, you have to help them with meals, because some of them needs assistance with meals, so you have to feed them and help them eat. Most of them needs assistance with transfer, so maybe you have 6 out of 10 needs a lifter, or you have 6 out of 10 2 staff assist, and then constantly going to the toilet. So that's where you transfer using, they have machines there that that has Sarah Steady or a sling hoist, so you have to use that for transferring and everything. So I would say manual handling is heavier in an aged care facility. That was only based on my experience, guys. So if your experience is different, then we have different experience then. But anyway, that is the manual handling side. There's a lot of skills that that can be done in the ward, because you have, like, you can get blood transfusion there, you can get IV, you can get anything, catheter care, NGT care, like all those skills you get in the ward as an EN. You will encounter all that. But in aged care, they are more like stable elderly. So we have, maybe you get dementia patient as well, so you have to deal with behaviors and everything, sundowning. You have to keep them occupied, provide them with activities and everything. So it's really different working in an aged care compared to the ward. So if you ask me which area I prefer better, well, even though in aged care it's a bit heavy, but I love the elderly so much. I just love them. Just reminds me of grandparents. Well, you get elderly in the ward anyway, but the connection that you have with the residents in the aged care is so much different from the connection that you get in the ward, because in the ward they come and go. Like once they get better, the next time you go on a shift, they're not there anymore. So in the aged care, like, they always there. Like maybe they only they will only be gone if they passed away, that's it. But they always there, that's their home. Yeah, but in the ward, yeah, you get most of the skills. If you want to, like, you want to practice more on your skills, you can choose in the ward. To sum up, patient ratio is lesser in the ward compared to the aged care. Medication wise, in the ward is different. While aged care uses a Webster pack. It depends on how you find it easier, either the one in the bedside or using a Webster pack. So it only depends on yourself how you get through using those 2 types of medication administration, as long as you practice the 5 rights, or maybe there's 10 rights now. So as long as you practice those, it doesn't really matter how you give the medication, as long as you double check before you administer. Manual handling wise, I would say in the ward is much less lighter compared to the aged care. Wage salary, I would say private aged care is much lesser compared to the public aged care or public hospital. So yeah, it's like yeah, you know you can now measure really where aged care and public hospital sits on. So anyway, I think that's all for today, guys. I hope I answered some of your questions. If you have any questions, guys, just leave a comment down below. And if you have any videos or suggestions of a video that you want me to do, just comment down below, and I will try my best if I have time And yeah, I hope you learned something from this video. I'll see you guys next time. And if you haven't subscribed, don't forget to subscribe. And see you guys. Take care. Bye.